We are live.
Good evening, everyone. On behalf of NASH 24 into 7, I welcome you to our public awareness program on the topic Beat NASH for Healthy Liver. NASH 24 into 7 aspires to bring best in class education and awareness program to serve healthcare workers, patients, and their caregivers. To speak on the topic, today we have a renowned gastroenterologist, Dr. Anshul Gupta from Mathura. He needs no introduction, however, I would fail my duty if I don't mention that. He is a leading gastroenterologist in Mathura, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has over a decade of experience building a clinical skill set that allows him to deliver patient centric care. He is a consultant gastroenterologist at Healthcare Polyclinic, Mathura, and we really salute his dedication towards spreading awareness related to liver health and diseases. So now I invite Dr. Anshul to enlighten us on Beat NASH for Healthy Liver. Over to you, sir.
Good evening, everybody. I am Dr. Anshul Gupta, gastroenterologist from Mathura, Uttar Pradesh. Today we are this program on a NASH day. NASH is nothing but non-alcoholic steatohepatitis. This is a public awareness program so that the patient and the public knows about this disease, and they should be educated so that they can be prevented by some lifestyle modifications, and if they are being diagnosed by NASH, then they can get treated in a place nearby with a gastroenterologist. First of all, we should know what is NASH. NASH is nothing but short form of a disease which is also known as non-alcoholic fatty liver disease. NASH is a component of it. It is known as non-alcoholic steatohepatitis. Basically, liver is a solid organ in which if there is a deposition of the fat. Fat deposition can be because of excess alcohol consumption, and it can be because of the various other causes. Non-alcoholic steatohepatitis means a patient who is not consuming alcohol, or that is the mentioned alcohol, which is known to cause a liver disease, and is not taking occasional drink is not considered as an alcoholic, but a frequent drinker, what we say is 20 grams of alcohol daily for many years. So that type. So if those patients also are coming us to with liver diseases, so this is known as NASH, that is non-alcoholic steatohepatitis, which is also being known in many places as metabolic associated steatohepatitis. That is NASH. This is known as non-alcoholic. First is they should not be a proper alcoholic. So what are the risk factors of NASH? First is diabetes. Second is obesity, overweight. Third is genetic factors. Fourth is sedentary lifestyle. Fifth is lifestyle eating, plenty of junk foods and high calorie food. These are the risk factors for NASH. So how do we diagnose NASH? Basically, this is a disease is asymptomatic. So you should be more careful. What is asymptomatic means? No symptoms. कोई भी लक्षण नहीं आते. Means no symptoms. This patient will present to us with no symptoms. Generally, a patient goes for a routine checkup, comes with elevated SGOT, SGPT. That is nothing but these are the liver enzymes, what we commonly known as LFT. In LFT, we see that SGOT, SGPT is elevated, and ultrasound is done, there is a fatty liver. So these patients generally, when there is awareness about the health nowadays, everybody is getting their routine health checkup in 1 year or 2 years, and many health insurance company are also providing annually health checkup. So they see that ultrasound is fatty liver and OTPT is elevated, mildly elevated. But many of the patients get confused. It's routinely present in everybody. So they neglect it. So it should not be neglected because this is an initial stage. If you meet a gastroenterologist properly, or a hepatologist or a gastroenterologist, he will guide you properly so that you can be treated properly. So now coming to the NASH incidence. What is the incidence? Means prevalence. Prevalence means how much disease we are seeing in this. According to the recent studies conducted in many of the renowned institutes in India, we are seeing that it is around 1/3, that is around 35% of the patients are suffering from non-alcoholic fatty liver disease. So nowadays what we are seeing the liver disease is, everybody has a misconception that only alcohol is known to cause a liver disease. No, nowadays in the OPD, routine OPD, what we are seeing are major of the cases are non-alcoholic fatty liver disease, that is NASH related. Non-alcoholic fatty liver disease. So it is 35%. It is both in urban and rural. Not that if a patient who is staying in village is doesn't have NASH. So, and even in school going children and rural children and urban children, the prevalence is around, in some of the recent studies, it is around 30 to 35 percentage, means 1/3 of the population are suffering from NASH. So many people don't know what is the reason why we are seeing so much of NASH cases. Because first is sedentary lifestyle, eating of junk foods. Everybody is eating chips, cold drinks, everything, processed foods, high sugar foods, high calorie foods. This is the one of the major cause. Second is there is sedentary lifestyle. Even the everybody is traveling on vehicles or mopeds, no physical exercises. Many people are not doing any physical exercise, sedentary lifestyle. So this is the two main cause, which over a decade this has increased, because over the decade the processed food intake is increased, and over the decade, because of this loan and everybody is having mopeds and vehicles, so nobody is traveling or walking much, and they don't do physical exercises much. So because of these things, and even the child, because of these video games, everything indoor games, they are not going for outdoor games. So the patients and the children also, the child who generally used to go outside play is not being, outdoor activities have been prohibited. So the children also, they are being affected more in this way. So what we can do, first of all, you should know that you are suffering from NASH. Many things is that if you don't know you are suffering from NASH disease, you will not go and consult to a doctor. First of all, you should understand that what is NASH. Many people come to us at the last stage, at the cirrhosis stage of liver. Then they will say they will develop jaundice, ascites. Ascites is nothing but abdominal cavity. There will be fluid filling. Jaundice is nothing but the yellowish discoloration of the eyes, what we say pilia in Hindi. They come to us, then we diagnose, then we come to know he was associated NASH associated. He has gone into last stage of liver disease. So first thing is that you should know any patient who is obese, overweight, diabetic, family history of cirrhosis, routine blood checkup showing altered lipid profile, and SGOT, SGPT is being elevated, or ultrasound is showing fatty liver, please come and consult to a gastroenterologist near you so that he can guide you properly. Are you, it is a simple fatty liver disease? Are you in an advanced NASH related, that is steatohepatitis disease? So he will guide you. He will get you routine tests like LFT. He might get you a fibroscan if indicated, which is to detect the liver fibrosis, which is an advanced stage after the NASH steatohepatitis goes into the fibrosis because of the chronic inflammation going on there. The cells of the liver gets hardened and got into fibrosis. So he will guide you properly. So first of all, my main purpose of this program is that not to deliver a lecture, what is that, but how to identify to a common people. If I am a common people, I have got a, how can I know I have a NASH or not? If you are overweight, if you are obese, if you are diabetic, family history, eating sedentary lifestyle, and your ultrasound is showing any grade of fatty liver, and or your LFT is altered, please consult a gastroenterologist. He will guide you that you need any medication, lifestyle modification or nothing. First thing, this is the first thing you should do. Second, what all things you can do prevent so that you don't get this disease? What all the things you can do? First of all, you should have a good physical activity. Every person should have a 15 to 20 minutes brisk walk or exercise or yoga or swimming or cycling or treadmill running. Whatever physical exercise they know you should. And they should not eat high calorie food. High calorie food is, that is the processed sugars, excess of fat containing foods like samosas, burgers, tikis, pizzas, excess of fat. Second thing. Third thing, if you're a diabetic, please keep your diabetes until check. Consult a routine physician or endocrinologist, whoever you are consulting. Get your sugar always checked and check that it is not being, it should be under control. Fifth, you should do a fifth thing you should do is you should do be a regular monitoring. So if you're a high risk patient, you should do a regular monitoring. Like you should get a annual checkups done so that if you are going into high risk criteria or if your liver parameters are altering, so that it can be controlled in that way. Third, there can be combined thing also. Some people maybe alcohol consumption, fat, diabetes, everything. So all these three diseases can also come together. Like fatty liver can be because of alcohol also. If you have a one risk factor, like you are already obese and diabetic and you are still consuming alcohol, then it can be more dangerous to you. So this is the thing you should keep it in mind. Next, what all you can do means there are many treatments available for it. I'm not going into the treatment part because it is a public awareness program. So you should be aware that there are treatment available which can be given. Many of the drugs are available which has been approved, like vitamin E, saroglitazar, UDCA, that is also deoxycholic acid, obeticholic acid, and many more drugs which are being under also investigated for getting treated for what we say fatty liver disease, which is being treated according to the condition of the patient. First of all, you should know the spectrum of the disease. What is the spectrum? One is the liver is a normal liver. Next is fatty liver. What is fatty liver? It can be alcoholic or non-alcoholic. What is non-alcoholic fatty liver? No history of alcohol or no history of alcohol means occasional alcohol we won't consider. The routine alcohol consumption generally we consider. So it should be less than 5% of the fat content of the liver. Is there, then it is non-fat, no fatty liver disease. But is more than 5%, we go into NAFLD. What is NAFLD? Non-alcoholic fatty liver disease. This is a one is a simple fatty liver. In this only simple fatty liver, only liver content, liver is showing fat, but there is no inflammation. Next is NASH. What is NASH? The liver is showing inflammation. How can we detect it? Liver inflammation can be detected generally by SGOT, SGPT, or a biopsy. So biopsy has not been recommended nowadays because many people will not go for invasive procedures. So we can go SGOT, SGPT. If SGOT, SGPT is persistently elevated, that is, these are the liver enzymes. We also call it as AST, ALT, SGOT, SGPT, or AST, ALT. It's the nomenclature is different, but both are same. So if these are being elevated, next what we do is we see other causes. If there are any other causes also associated which is leading to SGOT, SGPT elevation, if there is no SGOT, SGPT elevation and what are the risk factors I have mentioned, then we generally consider that patient on alcoholic fatty liver disease. If required, we go for a fibroscan. What is a fibroscan? It is nothing to detect the fibrosis and the fat content. Actually, how much is the fat content and fibrosis? Next stage is fibrosis because of the chronic inflammation, that is NASH. The liver goes fibrosis, that is becomes hardened. When fibrosis, next the fibrosis is graded as F0, F1, F3, F4. When there is a last stage, we call it as cirrhosis. That is cirrhosis, that liver is altered. When a patient goes into the liver cirrhosis stage, it can't be reversed back. It can't be reversed back. I repeat it again. So main thing is that we always try to diagnose patient in an early stage so that we can prevent a patient going into liver cirrhosis. If the patient has gone into a liver cirrhosis, then he will develop like decompensation sign. Like decompensation sign is like jaundice, any GI bleed, any ascites, any hepatic encephalopathy. These are all the signs, and later on malignancy. Many times patient comes to us in OPD directly with a hepatocellular carcinoma, that is liver cancer. Then we routine investigation, we won't find any other cause. We see he's a diabetic from long year, he's having obesity, he has not been focused on his liver health properly. Because a patient when comes into a diabetes, he only focuses on diabetes, he doesn't focus on any other disease. So you should, if you're a risk factor person, you should always see your liver health is also proper going on. The main problem is that liver health is very important because the liver doesn't show any symptoms. Liver disease will not show any symptoms until unless there is major inflammation going on in it. So these all are the silent killers. What we say, silent killers, slowly, these disease will progress, and once disease is progressed into cirrhosis, it can't be reversed back. So I again repeat it again, repeating again and again, because this is most important. You should know you are suffering from a liver disease or not, which can't be diagnosed by the symptoms. Symptoms will appear. Symptoms means लक्षण. लक्षण तभी आएंगे जब आप advanced disease में होंगे. I repeat in Hindi again. लक्षण तभी आएंगे जब आप advanced disease में होंगे, वरना आपको लक्षण नहीं आएंगे. So I request you, please consult a doctor or a hepatologist or gastroenterologist nearby you if you are a high risk person. USG is showing fatty liver and SGOT or SGPT is being elevated. So from now onwards, you should also try to keep your health proper. Like you should have a good green leafy vegetables, avoid fat food, avoid excess of sugar, do a proper exercise. These are the main thing. Main thing is calorie. How much calorie you are taking and how much your expenditure. Many people don't know how much calorie they are taking. Like I am a doctor, I don't have much of physical activity. I sit in chair and see patient. So I don't need that much of calorie. My calorie intake will be less. If a patient who is working, he is a hard worker, he is working in the fields or he is working in the building construction area, he is a laborer, he needs so much of calorie. If he eats that much calorie, he is expenditure of that much calorie. He is expending. Oh, itni calorie kharch kar raha hai, he don't have a problem. But if I take that much calorie, I will have a problem. So that's the main thing. Nobody knows excess eating. Anybody don't know how much we should eat, how much calorie we should take. Nobody person knows. So calorie intake is not dependent on your age and weight. Calorie intake is dependent on your age, weight, and how much work you are doing. You are a heavy worker, you are a moderate worker, or you are a low worker. So depending upon that, your is calorie intake. So you should know your calorie intake properly. Consult a doctor or a dietitian nearby you. Know how much calorie intake should be there. Take that much of calorie. Avoid excess of food and keep in there. Keep your liver parameters checked regularly. If you are there, if you are having family history, you should get a frequent check, or otherwise annual checkup or yearly, twice daily. If you are a young patient, you can have a checkup thrice a year. It's enough. If you are an old age patient or diabetic patient, then you should have a checkup yearly once. So I want to public awareness is that public awareness. Mine today main objective is you should know your disease. Otherwise, you will end up in trouble. I am also ready for any questions. If anybody is there, they can ask any questions. So I'm not going into the treatment part of it. Basically, there are many drugs available, what I've already mentioned, and treatment part is not being discussed much. This is that you should know your disease, and any questions are invited.
Yeah, thank you, sir, for this wonderful talk. This has really enlightened all of us. Now we'll take questions from our audience. Sir, the question is how long the medicines for fatty liver will continue? Like diabetes, it is a lifelong.
Diabetes is a lifelong disease. Now it depends upon what I said. It is a stage. If you are coming in a cirrhosis stage, then it is lifelong disease. What I told, it won't be reversed. If you are coming only in simple fatty liver disease, generally in 3 months to like only SGOT, SGPT is being elevated, inflammation is there, we can control it in around 3 months, that is 12 weeks to 24 weeks. We can control it. If it is a fibrosis, generally in a fibrosis stage, generally we can give up to 6 months to 12 months if it is required. So generally, but these medications are last. But the what I told, the dietary modification, the physical exercise is the first, because it should be done along with these medications. So it depends upon the stage of this, in which stage you are coming. Patients coming in which stage. Many patients are also having comorbid disease, like he is having diabetes also. Diabetes is not controlled, everything is not controlled. So the time will require drugs to a longer time. Otherwise, 3 months to 6 months only for simple NASH. If it is associated with fibrosis, 6 months to 3 months to 12 months is sufficient generally, and depend upon patient to patient. But this is generally 70 to 80% patients come under this criteria.
Sir, what if I am not obese, so I am at risk at NASH?
Yeah, there is a this is a very good question, because this is also seen that obese is a risk factor, but nowadays we are seeing patient known as lean NASH. What is lean? Lean in Hindi simple means patla. जो पतला है उसको भी NASH. What we say, अरे मोटा है इसको NASH के chances ज़्यादा है. हाँ, that is true. But nowadays we are seeing a patient with lean NASH also. These lean NASH people are literally difficult to treat, because it depends upon their genetic tendency also, or this one, because he is not having excess of fat, he is lean, but his ultrasound and fibroscan is showing that liver is having excess of fat. So in these patients, generally we require drugs also, as exercise is also required. We tell them to do exercise also, but drugs in these patients, these are the subtype of patients which may require drugs to a longer time. So I say risk factors are those things, but not that you are a lean person, you will not be suffering from a NASH. So I told you should, what I told initially, that your ultrasound and SGOT, SGPT. This is the simple test which is done ultrasound everywhere in each and every small and small city is available. SGOT, SGPT is a liver enzyme, easily test each and every places it is available. I am also staying in a Mathura, which is not a high tier 1, tier 2 city. It comes under tier 3 city. Everything is available here also. So you should know when the disease is. Lean NASH is also a component. That is a person who is having thin can also have a fatty liver. So you should be careful.
Sir, kitna weight? How much weight loss would be the ideal weight loss, sir?
So ideal weight loss depends upon the ideal excess weight you have. Ideally, what we say is at least 10 to 15% of the weight loss should be there. Okay. patient who is having BMI of 35 and above, I tell him for him 10%, I will say you can lose for 20%. But ideally, what we say 10 to 15% of the loss should be there at least minimum. 10 to 15% should be minimum. Around, depending upon the obesity also, till 30% also we say you should have a weight loss. And weight loss regimen, now this question has come. So many people, what they do is that they don't do exercise till then. When they meet a doctor, they say, doctor ne bola, "Arey yaar, exercise karna." Then what they, next day, josh mein, they start running for half an hour. Then they, "Arey yaar, पैरों में दर्द हो गया, everything, I am tired." Then they don't do exercise at all. So never plan exercise in that way. Exercise should be, if you are regular exercise, okay. If you are not a regular exercise, like you are 30, 35 years, you never exercised previously. Now you have been diagnosed as NASH. I recommend you go for exercise. So I don't recommend a patient like that. You go 15 minutes brisk walk. If I tell them, write in my prescription and tell them. So what they do, they go 15 minutes brisk walk from the day one. From the day one they do, they start paining their legs, they get tired because they have not been accustomed to do walk 15 minutes regularly because they are working always, they are using car or moped. So what I recommend is that when you are starting your exercise, you do 1 to 2 minute brisk walk. Daily gradually increase it to 3 minutes, then 4 minutes, then 5 minutes. Then after 5 minutes, take a rest of 5 minutes, then 1 minute, 2 minutes. So in 1 or 2 months, I think 15 minutes regular brisk walk you can come. So at least 15 minutes regular brisk walk in morning or evening, or at a stretch you can, if doing morning in one time you are doing exercise, 30 minutes brisk walk is enough. A simple exercise. But rest all exercise are like swimming is also good exercise, cycling is also good exercise. If you're running in a treadmill, it is also good exercise. If you're doing aerobics also, that is also good exercise. You're doing yoga exercise, that is also good exercise. But brisk walk is very, very good. Simple exercise everybody can do. It is not that you're simply walking. It should be a brisk walk. Your hand movement should be proper and you should properly brisk walk so that your legs should pain initially. When you're starting your exercise, your legs will pain for few days. You should plan your exercise in this way. And weight loss, what I have told, the question is that 10 to 15% till 30%. Slowly, in a month or 6 months, your aim should be there. You have to reduce weight. Not that I have to reduce weight in 1 month only. Then you will gain in proper. Both diet and exercise, both are required. Not only single thing you can do, weight loss. But if you have any physical issue, like you're not able to walk properly, you have osteoarthritis, you have any fracture of the limb, then only thing is that you have a diet only. So you should properly follow your diet so that only can help you. Because if you have any physical constraint, otherwise you can do a proper exercise.
Yes, sir. So I think the next question is also answered by you in this question, sir, about exercise. What duration of the exercise would be the ideal one to initiate the weight loss? So I think you have already answered, sir. So on behalf of NEST 24/7, I thank Dr. Anshul Gupta for this lively and informative talk. As you have been emphasizing the awareness on liver health and disease, it is also important for people affected by fatty liver to regularly visit the doctor and continue medications if required. With careful observation of precautions, it is possible to obtain the control of this NASH. I would also like to thank our audience for their active participation and patience in making this event a successful one. You may also share your suggestions so we can address them in our upcoming FB Live programs. Stay connected with NEST 24/7 on Facebook and YouTube. Take care of yourself and your family members. Thank you once again, sir, and thank you all.